How does it feel to be back at MD Anderson?
It feels weird.
We're hoping for the best, that his scans come out clean.
But you see that.
Well, that one's all done. We're all now. Got your uniform?
Can get the rest of my IVs.
I wish I could.
Yeah, I didn't feel nothing. It felt like a little ant party. Kind of slow. I've been drinking water all day.
I'm just in the bed. You're good. Chill.
Oh, okay. You gotta do what you gotta do. I didn't feel nothing.
Hello friends, we're still here at MD Anderson. Jake is getting his MRI done right now, and I finally found a place where I can relax in silence and away from everybody. I've been struggling with insomnia really bad, and so I have been up for at least 24 hours now. I drove all the way over here, and I'm just like, now I'm exhausted. Now I want to fall asleep. We have no plans to stay anywhere. We've looked and called, and everything is booked due to some soccer game at the NRG today. So we're gonna see if we can just hang out here at the hospital all night, or maybe just even like sleep in our car. Because at this point, I mean, we don't want to drive out to Katy or Galveston or anything, or Sugar Land. It's just too far away from the doctors here at MD Anderson, and I just want to be here close enough to when we come back tomorrow morning for his results, we can just be here and then go. I don't want to be traveling, plus I'm just way too tired. So hopefully I can get a little sleep in. I've been trying to nap off and on, but you know, people can be loud here at the hospital. But now that everything's pretty much closing down, it's around, I think, 5-ish. A lot of the offices are closing up for the day. So I found a little spot in the corner while JD's getting his MRI done on the other side. Let me show you really quick. So down this hallway onto the other side is where the MRI machines are. And I'm over here on the outpatient. I think it's chemo or something, or oncology. And there's some computers here I could use too if I wanted to, but I'm just way too exhausted. Plus I had a really rough night yesterday. Like I said, I haven't been sleeping well, and then I got the bad news that my beloved dog, who I had for over 13 years, who last year I gave to a rescue and was adopted, thank God, by a great grandmother of a child that I used to sit for. So got the news that she passed away 2 weeks ago, and it affected me so deeply. I loved that doggie so much. It was more than just a dog to me. It was my family. She was my everything, and it was so hard for me to let her go to be placed with another family. But I'm so glad that she went to the family she went to. They loved her, spoiled her, took her to her vet's appointments and everything. And I know it should have been expected. You know, she was 18 years human years and 88 in doggy years, so it was to be expected for her to, you know, it was her time to go. But I just wasn't ready to hear it. I didn't want to think about it, and it just really triggered some emotions yesterday. So now that I'm finally like in a relaxed space, I can just like maybe take a nap and get comfortable, because it might be a long night. All right, talk to you later. Bye. So we're walking back to Hospitality Apartments. We still haven't found a place to stay at, so we're gonna stay in our car. It's really humid right now, so there are a couple of hotels nearby, so I'm just gonna go in and see if they have anything as of right now. But if not, we'll just have to bear it in the car. It was a long day, and like usual, it's all day long that we're in the hospital for scans. All right, guys. Well, wish us luck. Bye.
In the left side of the dural covering of the brain. I looked at that with the radiologist, and it's new. It was not present on the prior scan. The rest of the PET scan actually looks pretty good. So the rest of the body is good. There may be a tiny little thing in the lung, but it doesn't look too concerning. The main concern is the one up here. I showed it to Dr. Ferraroto, and Dr. Ferraroto wants to see you today to look at options for treatment.
That scares me.
Yeah. The area where the main cancer was remains to be clear. So then the question is, what are the options for treatment? And that's when Dr. Ferraroto will see you and talk to you about that. Who gave you the radiation?
Rosenthal?
I think so. I'm not too sure.
Dr. Rosenthal. That sounds about right.
And he did the two. He did the regular radiation and then the beam.
Right. So we'll get things going, see what options for treatment we have.
He's just a little upset because we just barely went back home
I
and
know.
got an apartment and started to pick up the pieces.
I know.
But we'll be okay.
The last scan was really good result. Yeah, I know. But the main thing is to identify it early and start looking for treatment options. So, and she was so gracious to say she's going to see you today right away, so that no loss of time. I asked her to add you on her schedule, so it might be a bit of a wait because you didn't have an appointment, but she's going to work you in.
Okay.
Is this one worse than the last one as far as cancerous or?
Well, the fact that it is a recurrence after treatment makes it more aggressive, yeah. And then the location is also a little bit more tricky because it's in the covering. It's not in the brain tissue, but it's in the dura, which covers the brain tissue. So that makes it also more challenging.
And is this one treatable also?
Well, so that's the main question. Is it treatable? And I think that we have some options. whether it's going to be a clinical trial or a drug therapy or more different kind of radiation, we'll have to see. But I don't think surgery is going to be part of it. Yeah.
Okay.
No more surgery on that.
Because
Yeah, that
that's
was,
the last surgeries
Yeah.
my intestines were
yeah, I know.
not waking up.
Yeah, you had some trouble.
I don't know why I pray and this happens. And it's sad. It's like,
Don't give up hope.
I'm not giving up hope.
Have a lot of faith.
It's discouraging.
Yeah.
It's disappointing. I understand. But we're not giving up on you, and you shouldn't give up on yourself.
I was telling her, I said, they were trying to send me to collections because now I'm on disability, I can't even work.
Yeah.
And I don't, I'm going to pay, these bills now. It's, it's,
Let's just focus on your treatment now. Yeah. All of that we can work through. Just focus on your health and your treatment. Don't worry about that part.
I'm just scared.
I know you are. It is a scary time, and I know that that's not what you expected today. And but the main thing is that we identify it, we look for a plan, and we move forward with fighting it. Okay, we'll get you going so that we
Alrighty.
don't lose any more time. All right.
Hello, founding friends. Sorry, but we're in Houston getting my 3-month evaluation for my cancer. Early this morning, I found out I don't know if it's the same cancer or different type of cancer, but some form or some way it came back. My oncologist and my main doctor, they had a little appointment today, a little talk. And they found out that she wanted to come see me. She wanted me to come see her today to see what the steps are to beat this type of cancer, or that's in my head, and that's something that's a little kind of iffy on my lung. I don't know what type it is this time. I don't even know what it is. Who knows? Maybe it might even be cancer. We don't know yet. But it's something they want to look at. Hopefully, it's not anything that I have to get surgery on, because my previous videos I did not do very good with my operations. So we're just here waiting for my doctor to come in here and see what we're gonna do. I hope it's not anything seriously bad, but we can all wish the best. And pray for me. Hopefully we'll get through this together once again. The doctor said, they didn't say it's life-threatening, but it just said that they want me to know what's going on with my head and my lung. God forbid, who knows, maybe it's not any of those, but just keep me in your prayers. And when she gets in, we'll go back and film some of her words she's going to tell me, and hopefully it's good news. Talk later. Bye.
I remember you even said that maybe he was a little better, but he was kind of growing up a little bit. So, and there's really no standard therapies for this, right? The only off-the-shelf drug that we can get outside of a clinical trial is basically chemotherapy. Sometimes we can make the case to get a few pills, but you do have a little bit of bleeding there, and with the bleeding, the pills is a little dangerous, and the chances of major shrinkage of the pill is only about 10% too. So what I'm thinking here, just because the place that it is now, it's a bit tricky. You don't have any symptoms, but if it grows more, it can, press into the brain, and because of the skull, there's not a whole lot of space for this to grow. I think that I probably would want the radiation doctor to kind of take a look and see if they could just do a little bit of radiation to the area to try to shrink that down, give us more space.
Okay.
You know, I think that may buy us sometimes. It's not going to make it disappear, but nothing will at this point. Okay, so it's just something to try to put this at bay, get some shrinkage, and hopefully we can have you have more time with quality. And I probably would try that first over drug therapy, particularly if you cannot try any new drugs that has a higher, you know, potential of helping. I do have a few clinical trials. I just don't know because I heard that your insurance may be an issue.
Yeah, it's the same insurance you had before. It's just we are paying for it.
So I have to pay like almost $500 a month because right now I'm on disability.
I see.
And his job let him go
I see.
while he was still here.
Okay, so I still wanted the radiation doctor to evaluate you just to see what they think. But in this scenario, if you are able to get care here, I can potentially screen you for a few clinical trials with drugs that may potentially help. It's a bit early for me to tell you what are the chances of working, but one of the drugs, it is actually against MYB, and we know your tumor has a lot of that because we tested for it, you know, in the DNA fingerprint. So I just, sometimes when the disease is close to the brain, they don't always allow patients to go on trial because they never know how good the drug goes there, you know. But I can check on that. If you're able to treat here, I can send a few emails and see if that would be a possibility. Okay. There are a couple trials actually because that maybe if you can treat here, I can screen for, which I would favor over giving you more chemo because I already gave you chemo and I already know it wasn't great. So although it wasn't the typical chemo that we use for ACC, it's still chemo.
So is it still the same cancer?
Still the same cancer. We don't have a biopsy, but there's no reason to think that it's not, particularly given the time frame. I asked Dr. Hen about biopsy, but he said for you to do a biopsy, you need neurosurgery to do basically a surgery because of the place it is. It's not really accessible any other way. So I don't know. I mean, unless it's I don't think that the radiologist had any doubt that this was cancer. I think Dr. Raza was the one that operated on you as well, right?
I'm not sure. I remember.
The neurosurgeon. We'll run by him as well. I'll send an email with everybody, Dr. Hannah, Dr. I think it was Raza, just to discuss. But I don't think there's a lot of doubt that this is likely just the same thing that.
Yeah, because I was even telling Dr. Hannah's like, I already got, big bill and that's what's stressing me out. It's like, over $200,000 just, just with the bill, it just is draining me. It's like, sometimes I can't sleep, sometimes I sleep too much. It's just.
He's getting depressed and a lot of anxiety.
Depressed and anxiety. It's like, I don't know.
He just doesn't want to get turned away for treatment because of.
I understand, I know it's a tough situation, but I also don't want you to, it's not like I have a miracle treatment that I say, hey, sell your house and get the treatment. No, otherwise I would tell you, right? I also don't want you to get into, more financial distress for something that may not work. I'm not sure. It's not super high yield. It's not like.
Is it fatal?
Huh?
Is this cancer fatal? Like, can I pass away from it or?
It's not curable and you're pretty young. So I do think that, given that this is back and it's not too long ago that you finished your radiation portion of the treatment, and given that you are young and don't have any other health problems, like if you're, 8 years old and you have heart issues and things like that, sometimes, those, like, I do think that this is probably gonna be eventually be a problem for you.
So basically, right now we're just gonna try to keep him comfortable and keep it small.
We're gonna try to, obviously treat you with things that are meaningful, right? That can help. We also don't want to just give treatment that doesn't work just to feel that we're treating, right? So we need to find things that we think that could help you, to put the tumor at bay, have a shrinkage or at least not grow since you're not having symptoms, and buy you as much time as possible with quality. But I wouldn't be honest with you if I say, yes, I'm going to give you this and this is going to be under control forever. Unfortunately, that's not the case. Yeah, I think, hey, we don't have a cure, but you're not having any symptoms. We all know we're going to die one day, right? All of us. We don't know how much we have. Yes, I do think that this eventually is going to be related. It's going to be potentially the cause of her death because it's something that I cannot make go away in your blood. But how long do you have? I don't know. It's just, as she was saying, a few days pressure, live a day at a time and make the best of it. I'll send a few emails and but I do want you to see the radiation doctor because if we cannot do clinical trials, I do think the radiation has the highest chance of leading to shrinkage of what's there. I mean, we know that that's, likely there's not the only place that cancer is. There's microscopic cells elsewhere that the radiation is not going to work, but that's what it's, the bulk of the cancer now. So if we can put that under control for a while, that gives us more time that we can look for other options and, and put things at bay. Okay. All right. So was it Dr. Finn that radiated you, or?
I'm not too. Oh,
I'll look for it. Okay. So we'll refer you back to them, and I don't think there is overlap with the field because your tumor was very here, right on top, and this is much more there. So I don't think there is prior radiation there. And meanwhile, in parallel, I look to for the trials. If you are eligible for the trials, honestly, I think. We can potentially start with that because we follow very closely even 6 weeks, and if it's working, great. If not, we can do the radiation afterwards. But if there is any issues with you being eligible, potentially start with radiation. And I mean, the longer you are, things are under control. There's new drug developments, new things that are discovered. So what's true today is not, things may change. But I also don't want to tell you, hey, everything's going to be okay. This is going to disappear. So I think that, yes, we have a problem. It's, something that we can make disappear as of now. As long as you are healthy and we buy you time with quality, more things may arise and new options may come. Let me check her chart.
But the surgery, like if he was to get brain surgery, that would be the last option.
It sounded from Dr. Hanna when he talked to me that because he was in different places, there is also one in the middle here. He didn't think surgery was the best idea. Again, we're going to circle back.
He also said there was like a spot on his lungs.
Yeah, there is, but that's not as worrisome at this point. That's just, these are less than sub-centimeters, it's not even clear. The big problem is really the one in the lining of the brain.
And it's going to be like on his left side of the brain? What do you say was the left side?
I think it was the left side. Let me double check now. We saw this skin just now, but it's the left. Yes.
And what is that called? I can't remember that's
Dura?
The Dura?
Yeah, the name of it's Dura. D-U-R-A. Where is the radiation? So your neurosurgeon was Raza, Sean, so that's right. In your radiation oncology was Rosenthal. He was here. Let's see if he's still here. He was just here.
That's how I thought it was, Rosenthal. We'll take every day as a brand new day that God's blessed us with.
I'm gonna die, babe.
We'll focus on right now, what we can do right now.
Well, he's gonna see you today.
Oh, okay.
So that worked out well. He's seeing a patient downstairs, so you may need to kind of wait a little bit. But we talked to his PA, Sherry, and she said she can fit you in today. So at least you do it all today and don't have to spend an extra day. How does that sound?
That sounds good.
Right?
Yeah, that sounds good.
So at least we get all the assessments done. Everybody sees you, and then we're gonna discuss as a team to come up with a good plan. Okay. Any questions from me right now? It's a lot to process today, particularly when you're hoping for good news, right? All right, well, let's see Dr. Rosenthal. At least you see everybody, and I'll get back to you, okay?
All right, thank you so much. Thank you.
She said you can stay here in this room if you'd like to,
Okay.
okay?
Great, thank you. Bye. Thank you. Baby, you gonna do? I love you.
Why? I've been so good. I stayed away from drugs. I stayed away from everything. God, I'm just being hurt.
I'm gonna be okay.
I don't want to go, baby. I don't want to go, baby. Oh my God. I don't want to go. Why? Why did you have to be like this, Mom? Why?
You talking John? That's right. Nana's going through the same thing, baby, you know? She's fighting me. You're the fighting too.
Oh my God, babe.
You're gonna be okay. We take it day by day. Tonight, because I promise we don't know what's gonna happen tomorrow. And we have to do what we have to do, right? I mean, right now, they don't have the technology or the means that they don't want to open you up for no reason. They don't want to give you medicines that are going to help you. They're going to just try to keep it small, keep it from growing, keeping it from hurting
But I
you.
was so happy, babe.
You're still happy. Don't think about it. We're still happy. You know, yeah, because I was, there's still stuff going on there, but we're happy. We'll get married. Just, you know, we'll live every day to the fullest.
I'm scared away to get away from you. I'm just more scared, baby.
Scared of what?
What if I don't wake up tomorrow?
Well, we don't, none of us know we're gonna wake up tomorrow. We can't think that way. We gotta stay positive. We gotta stay positive.